While losing an hour of sleep last weekend was a temporary inconvenience for many of us, up to 1 in 3 Americans suffer from chronic insomnia. And a new study finds the lack of sleep could actually have substantial effects on your heart. Dr. Raymond Vlacancich, excuse me, I knew I was going to do this, Vlacancich with Virginia Heart Medical Practice is here with more on the new findings. And my apologies for that. I'd actually practiced and I said, okay, I'm going to get it right, but glad to have you here this morning.
Happy to be here, Maureen.
Absolutely. Talking about sleeping, and we know that you need your sleep, but now it affects your heart. What's the correlation here?
Excuse my bad pun, but this study was a wake-up call. Thought I'd get that one out there early.
Yes. I love this segment already.
Yeah. You know, sleeping is very important.
Yeah.
We traditionally know that sleep apnea has a relation with heart disease.
Yeah.
This study was important because this shows insomnia has a correlation with heart disease. And insomnia affects 1 of every 4 Americans. We define it as sleeping 5 hours or less a day, having difficulty falling asleep, waking up, not being able to get back to sleep, and feeling tired throughout the day and not being able to nap. So being as a common problem, linking it to heart disease is concerning.
So what can you do? I mean, we all need sleep. We know we would like to have more of it, but just our busy lives, what can you really do?
I think we don't put a lot of priority in our sleep.
Yeah.
And I am guilty as well. With 2 small toddlers, I know that sleeping is difficult, but reprioritizing, doing some simple things to help with sleep. Making sure the room is dark when you go to sleep, trying not to watch TV in bed, trying not to be on your phone while you're in bed, making the room a little bit colder to help with sleep. These are some conservative measures we can start with.
And so overall, do we have numbers about how serious this problem is in the United States?
I think 1 of every 4 Americans can be linked with insomnia.
Right.
And I think when you don't have an improvement with conservative measures, this study kind of reinforces we should be talking to our doctors about it, cardiologists, sleep doctors, primary care doctors.
There's also another study that talked about marijuana and heart health. And a lot of people are on the kick saying marijuana is better for you. It can aid in so many instances with different ailments. But there's a correlation now with marijuana and heart health. What is that? And talk a little bit about that study.
Yeah, another very interesting study coming out of the ACC, which is the American College of Cardiology. This was a study where people were able to respond with their own experiences, and they found that daily marijuana use was linked to heart disease. Now, what makes this more complicated is they didn't differentiate whether this was smoking or consuming marijuana in other ways.
Yeah.
We know that smoking in any form, whether it be marijuana or cigarettes, is dangerous for heart health. So this study brings to light that we need more information about THC specifically and its relation to heart disease. But again, smoking, bad.
Yeah, indeed. And we know that. Overall, when we talk about heart health, what can people do? We always understand, you know, working out, maybe a better diet, but what can people really do to improve their heart health overall? I know insomnia plays a part. We just talked about marijuana, but overall, what can folks do?
Sure. I think the big ones are lifestyle, because that's what we have the most control over, and that is being at a healthy weight, trying to exercise 5 days a week, 30 minutes a day of modest cardio, to eat a healthy diet. Mediterranean diet is usually what we recommend. And then when we've maximized those parts of our lives, seeking care from primary care to make sure that our blood pressure and cholesterol are well managed.
And should you be checking those regularly?
I think if you have regulated blood pressure that's normal, you don't have to check all the time. I think if you're changing medications or you have some high blood pressure readings at your doctor's office, doing a week or 2 of monitoring at home to get a better sense of what your blood pressure is important.
Important study indeed. Dr. Vlacancich,
yes.
Thank you so much for joining us. It
Pleasure.
was indeed a wake-up call. Had to take that pun from you. Thanks for being with us today.
Thanks a lot.
Appreciate it.